What's up, everyone? This is Larry with Yunique Medical, and if you're watching this, you're probably wondering if you have a hormone problem. So let's talk about it. So, as we know, hormones decrease as we get older. However, I'm seeing it more and more commonly in young people because of the world that we live in. So, you can be in your late 20s, early 30s, all the way up to the 80s, and I treat everything in between. So it can be gender specific on the hormones from a male versus a female. So I'll run through them both. Both men and women, two most common things that I hear. One is that you're tired. Two is that you have weight that you cannot lose. Then a number three is usually brain fog for men and women. And then after that, the symptoms kind of get a little bit different. So females can have hot flashes, night sweats, vaginal dryness, and a decrease in libido. But sometimes they'll complain that they're trying to crush it in the gym and they just can't gain mass. Men symptoms, typically a guy will just complain of fatigue and mental fog or loss of clarity. So those are the big symptoms. It's not all just about sex and erections for men. However, signs and symptoms of low testosterone in a man can result in erectile dysfunction. Um, so these are the kind of people that you're going to start thinking, okay, maybe I do have a hormone problem, and we do have a quiz for that. So if you click on our website, you can take our quiz to kind of to see if you may or may not have a hormone problem. So how do we treat it? There's all kinds of different ways to treat hormones, um, and there are some providers out there that they will fight like dogs over this issue on the best way to do it. So the way that I do it is I just try to think of normal human physiology. And that's basically how I practice all of my medicine and what I do is how do I match how we were built and how do I deliver hormones that mimics that? So there are patches, creams, injections, inserts for females, and they all can help to some degree. The only ones that I would completely avoid would be anything taken oral. Those have been proven to cause cancers and blood clots and a lot of health issues. So that would be the only one that I would say definitely don't do those. So they all have some benefits and they can help a little bit. But in my opinion, they don't match human physiology at all. And I'll tell you why. Whether you're putting on a cream or a patch, or you're a female and you're injecting or inserting, or you're a man and injecting, your levels are going to go up and down within a 24-hour period of time, most likely. So that's a pretty significant hormone ride to go from low hormones to high hormones to low hormones to high hormones, and it can cause some issues. So I don't like to do it that way. I like to use hormone pellets, and I'll tell you why. They're bioidentical, so that means they're going to match human chemistry. I'm dosing it for the individual, so I'm looking at labs, I'm looking at height, weight, I'm looking at how active you are, your age, your particular metabolic rate. Um, so they're bioidentical in that form. They match human chemistry. And then this is the one where it's released closest to a testy or an ovary. So it's pulsatile over time. So over a 24/7 period of time. So you don't have these large swings of hormones. They're consistent, kind of how the body was built. So therefore, it's matching human physiology, in my opinion. So I use a lot of them. I use pellets all the time. I've done probably 3,000 of these at this point, and it's an art. I learned from the guys at Soda Pelli and Dr. Tutera when he was around, and then you create your own art based on experience from there. And I'm the kind of person that I'm obsessive compulsive about how I do this. Bottom line, I take it very seriously. You are manipulating your natural biochemistry, so I'm obsessive about how I do it. I do a lot of labs, I do a lot of follow-ups, and I'm meticulous when it comes to it. And I definitely make my clients employ various nutrient supplementation. You've got to do your labs. You've got to follow the diets and the exercise regimes, because if you don't put all of these things together, it's like a puzzle. You won't get the effects that you're looking for. If you're just focused on hormones, and if your provider's just looking at numbers and just chasing them, you're kind of going to miss the big picture of how this human body actually works. So if you're interested in hormones, give our office a call, text. Follow us on all our social media, YouTube channel. We have Facebook and we have Instagram, and keep up to date as to what I'm doing and what I'm talking about. So I hope this video helps a little bit for those out there wondering if they have a hormone problem and should they be getting it addressed. And if you do find that you're symptomatic, get on it now, because we're only going to get older and we're only going to have more stress and we're only going to have to interact in this environment more and more and more. So the earlier you kind of start this stuff, the better off you're going to be. Kind of like the whole thing where you get Botox in your early so you don't have wrinkles later. Same scenario, but we're dealing with, the aging process of our body. So get out there and get optimized, everybody. Hope to hear from you. Drop any questions if you have them. Have a good day.